So hi everyone, welcome to One Academy. I am Dr. Saurabh Dixit and I am going to tell you something important about the instruments. So I have today selected 3-4 instruments for you, and these instruments are going to be very important, and I have started this series. I will be continuing with this series where I will be continuously bringing you some instruments. So the first instrument that I am going to show you is a Venus needle. Now you must have heard of this Venus needle, you must have seen. So what is the concept of Venus needle? It's a very simple instrument. This is what is the instrument that you can see. This is a Venus needle. Now Venus needle has a spring-like action. Can you see that spring-like action? This has a spring-like action, and you can see this, listen to this tit sound. So if I just lock this Venus, can you see this is sharp, this is very sharp. Can you see this is very sharp? But if I release this spring and now the beveled end is up. So what is the significance of this? When you are entering the abdomen, whenever there is resistance, the beveled end goes up. So due to resistance, can you see the beveled end will go up and the sharp needle will come, and when there will be loss of resistance, the beveled end again comes out. So what is the significance? When you are creating the pneumoperitoneum, the first entry is always a blind entry, and that is the time when you can actually puncture the viscera. So it's very important how you hold this varies. Holding of varies is also important. It is always held like a dart. So you don't hold the varies like this. There are a lot of people who don't know the actual holding. It is held like a dart pointed towards the anus at a 30-degree angle. So let me tell you something important, that when you want to create a pneumoperitoneum, what is the significance of using a Venus needle? Now Venus is always pointed towards the anus. Why? Because it's a long slender needle and it can very easily enter inside the viscera. But the point is that since it's having a blunted beveled end which comes out as a guard, the chance of injury is less. The second advantage, so the advantage number 1 is less injury, less than 0.6% injury is seen with varies. The second big advantage is slow and gradual creation of pneumoperitoneum. So gradual creation of pneumoperitoneum is the biggest advantage of this. Why? Because if you suddenly stress the abdominal wall, there will be a vasovagal stimulation, a vagal stimulation which will cause a sinus bradycardia, and sinus bradycardia is a very lethal form of arrhythmia which is going to happen during laparoscopy, and this is actually life threatening also. So once you have gone inside with the varies, the next is you will insufflate, and remember what is the rate of insufflation. This is very important. The rate of insufflation for varies, this is very important. This is 1 to 2 liters per minute. So you can understand, since it's a very narrow slender, it will not allow anything more than that, even if you set the flow rate to maybe 7 or 8. The second instrument that I am going to show you is this. What is this instrument? This is known as a port. What is this instrument? This is also known as a port. And what is this instrument? This is also known as a port. What is the importance of these 3 instruments? And this is what is really very important. Now when we talk about these instruments, the first important thing is, what is a port all about? When we talk about port, it is nothing but a combination of, what is this? This is a trocar and this is a cannula. So trocar plus cannula, this is actually known as a port. If you see, there are a lot of types of trocars also, lot of types of the cannulas also. So if you see, this is a pyramidal, we have pointed, pyramidal, cylindrical, lot of versions are there. This is a bladeless trocar. If you see, I will release the lock in this and just wait, I'll release the lock in this, and can you see, this is a bladeless trocar. If I poke this inside, it will go, but just see, I'm doing it for myself only, it is not going. So this is a bladeless trocar and this is a bladed trocar that we have. So what is this cannula all about? Let me tell you about the parts of this cannula. Here there is a valve, this is a valve, so I shall open it to you and I shall show it to you also. So let me show you about the valve. So what is the significance of this valve? Why do you have a valve? When the instrument is going inside, can you see the valve opens? If there is no valve, the air will exit out. So to prevent the loss of the pneumoperitoneum, this valve is there. There are a lot of type of actions of the valve. We have magnetic valve, we have that bearing valve also. So this is what is a trocar and a cannula together known as a port. Remember, this is an inlet for CO2, so you can allow the CO2 to go in, or you can just leave this closed, or you can even allow the gas to vent out. Now, one very important thing is how to hold a port. Port is not held like this. Port is not held like this. Port is always held in a pistil form. It is always held in a pistil form. It is the thinner eminence which is going to give you the strength to penetrate inside. So it's the thinner eminence which will allow you to enter inside, and this is what is very, 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 very important. So it is with the corkscrew movement that you enter inside the corkscrew movement. Remember, this entry is blind, so you need to be perpendicular, point number one, and second is very slow. The moment the gas, actually the abdomen is entered, you can see there are some holes, here. So the hissing sound comes, so this trocar and the cannula system is connected by this. So this is a hollow orifice, and you start to get that hissing sound. So that hissing sound indicates that you are into the right cavity. So this is 10 mm port, this is a 5 mm port. What is the difference? This port is smooth, this is ribbed. Now what is the significance of ribbed versus smooth? Smooth ports, many a times the port starts to slide in and out, and when you are inserting your instrument and taking it out, it becomes very difficult. But if you see a ribbed port, the ribbed port is actually more anchoring. So once the ribbed port is there, the anchorage is so strong that it is not going to slip off. Then the third is, what is the significance of this port? Now this is a classical endopath axle. What is this endopath axle? This is a universal type of port where even 12 mm, even 5 mm instrument can fix inside. Can you see it has a valve? So right from 12 mm to 5 mm, 10 mm, 7 mm instrument can fix inside. Anyone can go inside, not an issue. Just see, this is a 5 mm instrument that will also go, and there is no loss of pneumoperitoneum. And this is a 10 mm, 12 mm, this can also go inside. Now what is the significance? Now we actually say that one big contraindication of any laparoscopic surgery, when we talk about contraindication, is prior abdominal surgery. So when suppose you are going for a creation of pneumoperitoneum for a patient where there is bowel, lot of bowel adhesions are there. So imagine there are bowel adhesions, and in that case, if you do an entry with a port, so what will, if you do an entry with a port, what can happen? It can damage this. So this is a bladeless trocar with a hollow orifice, and what can go inside? Your telescope, 0-degree telescope can go inside. Can you see the telescope has gone inside? I will show it here. So can you see, if let us take this to be telescope, the telescope can go inside, and telescope has gone inside. Now we are cutting it through the layers, and every layer is visible on the screen. So this helps us in creation of difficult pneumoperitoneum, and this was the image which was asked also recently in one of exam. The exam was INI-CT, and many people were not able to see. So this is a bladeless trocar with an optical port. This is an optical port because yes, you can actually see what is present inside, and it gets locked. Remember, this is a lock. This is a lock. Once it gets locked, it will not. The camera will get fixed and it will not come out. And this is what is very, very, very important. So the third instrument that I am going to discuss with you is this harmonic scalpel. Now, what is this harmonic scalpel? Why this is known as a harmonic scalpel? Try to understand, there are two jaws. One is white in color, one is black in color. This black in color is the active piezoelectric jaw. So this black color is a jaw which can vibrate front and backward, and since this is a vibrating, this acts like a saw, and forward backward movement can cut and seal the tissue. This is a unique instrument which uses the ultrasonic energy, and many a time students are often confused between a harmonic scalpel and a vessel sealer. I am saying vessel sealer, but you people frequently know a term which is known as a ligature. So ligature is not the term to be used, it's a vessel sealer instrument that we are going to talk about. So let us talk about this instrument in depth and detail. So when you talk about this harmonic scalpel, how to identify this harmonic scalpel? If you see, one jaw is different and the another jaw is different. So there are two different jaws that we have, and this instrument is something like this, where we have a cavity behind. So I will show this instrument to you. We have a cavity behind, and through this cavity the ultrasonic, the USG transducer is connected. So when we talk about USG transducer, this is the transducer which will actually give the vibrating energy to this. So this is the lower jaw. This is the lower jaw, and lower jaw is always remembered as this is an active jaw. So active jaw, it is having forward backward vibrations in the frequency multiple of 11,000. So it can be 2, 22,000, it can be 3, 33,000, it can be 4 and 55,000. Remember, at 4 and 5 the vibrations are so rapid that it can cut, and at 1, 2 and 3 it can seal. So this is very important. Now you must be thinking, what is the significance of this jaw? The upper jaw, that is a Teflon jaw, that's a Teflon jaw, that's an inactive jaw, that's an inactive jaw, and that is actually the vibration dampener. Basically, when you are touching it against a tissue, the vibrations can knock off the nearby tissue, and that is why there is Teflon jaw. Remember, if this Teflon jaw is damaged, the instrument should not be used. Why? It becomes very dangerous. Try to see again, white jaw, black jaw, and then if you see this instrument, there is a cavity behind. So here you are going to attach the USD transducer, and then you are going to tighten up this instrument and use it. The frequently, you can say, misunderstood instrument is your vessel sealer or a ligature. I am showing you Marseille 5, which is from Keyless Martin. So what's the difference between a ligature, Marseille 5? Answer is they are working on the same concept, only the brand is different. If you talk about Ethicon, it is the N-Seal. If you talk about the Olympus, it's the Thunderbeat. If you talk about the Keyless Martin, it's a Marseille 5. So if you see, both the jaws in this case are same. Both the jaws are same. Both the jaws. Whereas, why this is a bipolar instrument? Whereas if you talk about this instrument, both the jaws are different. So both the jaws are different and same. Then you don't have any USD transducer. You have a USD transducer cavity here, but you don't have any USD transducer cavity to be attached here. So it is simply having one blue button which you press and it is going to seal. To cut it, every time whenever you insert, you have to take it out and cut it with the scissors. So now the companies have provided with a manual blade. When you press it, a blade comes forward and it will manually cut it, but you cannot say that it can cut and seal. So this is very important. If you want to see it in a difference in an image, I shall show you this thing also. So if you see both the instruments, both the jaws are same. Both the jaws are same for this instrument, and there is no USD transducer which is attached behind. So the instrument design is totally different. If you see, both the jaws are different here and both the jaws are same. Now one very important thing is, what is their concept? What is their concept? This works on bipolar. It's a bipolar. So it's a bipolar instrument, and this works on the concept of ultrasicon technology. Now what is this ultrasicon? It is utilizing the sound energy. So it is using the sound energy. So something is sound energy based. So it's a sound energy based. And whereas when you talk about this technology, this is very, very, very important. This is the concept based on electric current. So it's a electric current based. The only difference between this bipolar and a conventional bipolar is that conventional bipolar, if you keep on heating the tissue, it will heat. Once a scar is formed, and if you reheat a scar, there is a charcoal formation, and the charcoal will get dislodged and rebleeding will occur. But this is having a tissue moisture sensor. Once the moisture is desiccated off, it will actually cut off the cycle, and once it cuts off the cycle, the current will actually not flow through this. So students, this was a brief discussion on some important instruments, and I will keep this series active, and you will be getting a lot of you can say questions from them. And this is again a very important, these are the important instruments which help you gain your confidence in your vivas and during your surgical exposures. Thank you.